everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. In our previous session, as we have discussed in detail about physical examination, I hope you have got a clear idea of how we can perform the head-to-toe examination as well as the systematic examination. We've also discussed about the cardiac assessment, right? So in today's session, we are going to discuss about the respiratory assessment. So as we know that in every assessment that we perform, it is necessary that we collect the history as well as do the physical examination, right? So also in this respiratory assessment, first thing is we will be collecting the history. After the history is being collected, then we will move on to the physical examination. So as a nurse, it is very important that even before you collect the history from the client, you must first try to interview the client. You must first try to get to know the client, because if you are able to establish a good rapport with them, then it will be very easy for you to gather all the information which is required, and also it will make the client feel less anxious. So whenever you are performing this history collection for the respiratory assessment, you must make sure that you collect both the current as well as if the client had any respiratory problems in the past. So these information which you will be gathering can either be from the client himself, or can be from the family members, or even from their significant other. And whenever you perform this respiratory assessment, you should make sure that you keep in mind these 6 important respiratory problems. Why? Because here we will be assessing the respiratory system of the client, right? So if a client is having any respiratory disorders or is suffering through any respiratory diseases, then these 6 respiratory symptoms will always be present. So in order for you to be able to get an idea if the client is having any respiratory problem or not, you must first try to identify the presence of these 6 symptoms, which is coughing, sputum production, dyspnea, which means difficulty in breathing, hemoptysis, which means there will be presence of blood in the sputum as well, and then the client may have the symptoms of chest pain and wheezing. So whenever we perform this respiratory assessment, it is very important that we must find out whether these 6 important respiratory symptoms are present or not. Why? Because when you assess the respiratory system of the client, if these 6 symptoms are present, or if even 1 or 2 of these symptoms are present, then this will give us a baseline data that maybe the client may be having any respiratory disorder or may be going through any respiratory problem. So here, whenever you collect the history of the client, you must make sure that you ask these following questions. The first question can be, are you having trouble in breathing? Why? Because if the client is having trouble in breathing, then this gives us an indication that he or she is having dyspnea, right? As I've told you that dyspnea is also one of the important respiratory problem, right? So here, if you ask them, are you having difficulty in breathing? And if they say yes, then you should also ask if there is presence of pain in the chest when they are breathing. And if the answer is yes, then you should also try to find out what is the pain like, when does it occur, and also what relieves it. And then you can also ask them if they have cough. If they have cough, then you can also try to find out what type of a cough he or she have. Either it's a dry cough, or either there's presence of even wheezing while they are coughing. When does it occur? And also you should try to find out if there is presence of sputum as well. And if yes, then what does the sputum looks like? Because here, if it is a normal sputum, then this normal sputum is usually thin, clear to white in color, as well as it is tasteless and odorless. So if the sputum of the client is not normal, and suppose if the client is having a sputum which is yellow or green in color, then it may indicate that the client may be having a bacterial infection. And if the color of the sputum is rust in color, then it can also be a characteristic of pneumonia. So here, when you're collecting the history of the client, you should make sure that you ask them if they have trouble in breathing, if they have pain in the chest when they are breathing, and also if there is presence of cough, what type of cough it is, when does it occur, and also if there is any sputum production while he or she is coughing. And also you must try to find out the characteristic of that sputum. And you must also ask the client if they ever experience shortness of breath. And if they experience this, then you should also ask them when do they experience this, when they are performing any activity or even when they are at rest. And when you do this, you must make sure that you ask the client the specific questions about shortness of breath that had impacted them on their daily activities. Because why here, sometimes the client may experience this shortness of breath only when they are performing some activity, right? For example, they may experience this when they carry groceries from the car to the house, or they may experience this when they are doing the laundry, or when they are cleaning the floor. So when they are performing these activities, if they experience this shortness of breath, then you can note it down. And also sometimes you may encounter clients who may even experience this shortness of breath even when they are at rest. That is why here it is very important that you must know a detailed information about the client. You must not only know whether they experience this or not, but you should also know when do they experience it. You can also ask them if they have any problem while they are breathing at night, and also if they say yes, then you ask them what is the other alternative method which they do in order to help themselves breathe properly. For example, some people may use pillows. Okay, they keep the pillow in such a position where they will be able to lie down or lean on it and breathe easily. So that is why you must find out that whether they have breathing difficulty at night or not, and when they do, what is the alternative method that they choose. You should also ask them if they have any allergy, and if so, does this allergy affect their breathing or not. You should also try to find out about their history of smoking, whether in that particular period of time are they smoking or not, or have they ever smoked in the past. And if yes, then you must also try to find out how many years they have smoked and how many packets of cigarette do they smoke in a day. And you must also try to find out about their occupation. Why? Because here, if they are in a certain occupation where they are always exposed to the chemicals, to the radioactive materials, then this can lead a person to suffer from many respiratory diseases, right? So here, if there is presence of those symptoms, then you must also try to find out about their occupation. And also you must try to find out about their occupation. Why? Because here there are certain occupation where the client will always be exposed to the radioactive materials, to the chemicals, and this can be very harmful. Why? Because it can lead a person to suffer from many respiratory diseases. That is why if the client is having any of the respiratory symptoms, you must try to find out what is their occupation, because this can be one of the main cause why the client is suffering from these respiratory diseases. You must also try to find out about the personal, as well as if any members of the family is suffering from tuberculosis, from asthma, from lung cancer, from cystic fibrosis, from bronchitis, from emphysema, or from any other lung diseases. So these are the various questions that you as a nurse can ask the client, because there are various information that you will be getting from the client, which will be helping you to detect the main cause of the problem which the client may be suffering from. And whenever you are performing this assessment, during that whole process, when you are collecting the history of the client, you should make sure that you observe the client if there is presence of fatigue or discomfort. You must also ask the patient to take rest if it is necessary. And in case of infants, then what you can do is that you can ask their parents about the presence of any episodes of respiratory distress, of cyanosis, of apnea, of sudden infant death syndrome in a sibling or other family members, as well as if an infant is a passive smoker. And in case of a child, then what you can do is that you can ask their parents about any history of asthma, including the factors which is related to the asthma episode, which is related to the adequacy of asthma treatment, and whether or not the child has a history of right coughing, swollen lymph nodes, sore throat, or facial pain. You should also ask if there is any recent changes that is occurring in their exertional capacity, if they are feeling fatigue, and even if they require a more number of pillows in order to help themselves relieve from this dyspnea or from this difficulty in breathing when they are sleeping. If there is a significant change in the weight of the client, or if there is a history of sweating at night, and even if there is presence of swelling in their hands or legs. So whenever you are performing the history collection, these are the various information that you should collect from the client. And then after all of this information has been collected, so as I've said that this a physical examination include the inspection, the palpation, the percussion, as well as the auscultation. In assessing the respiratory system of the client, let us look what are the various things you need to inspect while you are performing this physical examination. So whenever you're performing this respiratory assessment, let us look what are the various things you need to inspect for in a client. So here, as soon as you encounter the client, you must tell them to sit and make themselves comfortable. And while doing this, you should make sure that you examine the patient anterior as well as the posterior chest. Why? Because here this chest inspection also allows you to see the visible external signs of respiratory function. So here what you will be doing is that you will be assessing the chest from the back, and you will also be examining or inspecting the sides of the chest if there is presence of any scars or wounds or even lesions. You will also look for the symmetry of the movement of the chest wall. You must also observe the duration for the inspiratory as well as the expiratory cycle. Why? Because here respiration involves inspiration and expiration, right? Where inspiration means breathing in and expiration means breathing out. So here, whenever you are performing this respiratory assessment, whenever you are performing this inspection, you should make sure that you inspect the duration of the inspiratory as well as the expiratory cycle. Why? Because here, by observing the duration of this inspiratory and expiratory, you can also make out if the client has difficulty in expelling the air. Why? Because here when we are observing the duration of the inspiratory as well as the expiratory cycle, we will be able to make out if there is presence of prolonged inspiration or prolonged expiration. And if there's presence of prolonged expiration, then the client will be having difficulty in expelling the air. And if he is having difficulty, then it can also serve as an indication that the client may be suffering from emphysema. You must also note the client respiratory pattern as well as the rhythm. So whenever you are doing this, you should keep in mind that in a healthy adult, inaudible respiration should occur between 12 to 20 times each minute. You should also try to find out if the client is trying to make use of the accessory muscles of respiration in order to be able to breathe in and breathe out. Why? Because here while breathing, it usually involves the use of the diaphragm and the intercostal muscles, right? And if the client does not use these muscles when they are breathing and they use the accessory muscles, then this should be noted. You must also try to observe if there is presence of intercostal retractions, if there is presence of nasal flaring, or presence of pursed lip breathing, because if the client is having nasal flaring, pursed lip breathing, or even intercostal retraction, because this will serve as an indication that there may be presence of obstruction in the airway or even can be caused because of poor ventilation. These intercostal retractions are visible identification between the ribs as the intercostal muscles helps in breathing. So what do we mean by intercostal retraction, by nasal flaring, and by pursed lip breathing? These intercostal retractions are visible identification between the ribs as the intercostal muscles helps in breathing. Intermittent movement of the nostrils in each inspiration and pursed lip breathing is the partial closure of the lips in order to allow the air to be expired slowly. You must also inspect the neck for the contraction of the sternocleidomastoid or other accessory muscles of respiration during the process of inspiration. Why? Because here normally these signs will not be present. That is, there will not be a contraction of the sternocleidomastoid or of the accessory muscles of respiration whenever the client is breathing in, right? Then it will give us an idea that there is presence of abnormality. And while inspecting, you must also observe the posture of the client. Why? Because here, if a client is suffering from COPD, that is chronic obstructive pulmonary diseases, then what happens is that he will lean forward and he will also probe himself up with his arms so that he will be able to breathe. Postural changes may also be seen with thoracic deformities such as kyphosis and scoliosis. You must also observe the client's level of consciousness. Why? Because if the client is confused or if there is changes in the mental status, then these are the important signs of potential respiratory problems. You should also note the age of the patient and the impact on the respiratory problem that he or she may be suffering from. You must also note down the age of the patient as well as the impact of the age on their respiratory function. You should also observe the client if there is any changes in the rate, in the effort, as well as in the sound of the patient respiratory pattern. So whenever you are performing this chest inspection, then the normal finding includes side-to-side symmetric chest shape, the distance from the front to the back of the chest, that is the anterior-posterior diameter, must be less than the size of the chest from side to side, that is the transverse diameter. So here you should make sure that the anterior and the posterior diameter is more than the transverse diameter, and if this is seen, then this is a normal finding. And usually if the chest of the client is normal, then you will also find that the shape of the chest will be normal and there will be absence of any visible deformity such as scoliosis, kyphosis, or even barrel chest, and there will also never be muscle retraction when the client is breathing. If the client is having a normal breathing pattern, then there will be a quiet, unlabored respiration with no use of the accessory neck, shoulder, or even the abdominal muscles. The normal finding of the chest inspection also include the regular respiratory rhythm with expiration taking about twice as long as inspiration, and also a skin color that will be matching with the rest of the complexion of the body. And also in case of an adult, then there will also be presence of a normal respiratory rate, which is between 12 to 20 breaths per minute. So here, whenever you are performing this respiratory assessment, you should make sure that you keep in mind that the respiratory rate, the rhythm will differ from the adult to the infants and to the children. Why? Because here the infants and the children have a faster respiratory rate as compared to the adult. A normal respiratory rate for a newborn ranges from 30 to 60 breaths per minute. So here, as we've seen, right, for an adult, the normal respiratory rate in a minute is 12 to 20, whereas for a newborn, it is 30 to 60. So depending on the age that the client is in, the respiratory rate will also differ. So while you are assessing the respiratory rate of the client, if you find that there are some abnormalities, then you can term it as the following. Here, if you find that the respiratory rate of the client is higher than the normal level, then it can be termed as tachypnea. Not only the client will be having a respiratory rate which will be higher than the normal level, but there will also be presence of rapid and shallow breathing. This tachypnea is usually seen in clients with restrictive lung diseases such as kyphosis, and also in situation where the pleuritic chest pain will be inhibiting the full expansion of the chest wall. The next one is the hyperpnea. So here, if there is presence of a rapid and a deep breathing, then it can also be termed as hyperpnea or even hyperventilation. This usually occurs as a result of physical activity, as a result of anxiety, as well as of metabolic acidosis. The next one is the Cosmol breathing, which is characterized by a slow, deep breath, and it usually occurs in clients with diabetic acidosis or for those who are under coma. And here, whenever the respiratory rate of the client is lower than the normal level, it can be termed as bradypnea. This bradypnea is usually seen in clients with drug-induced respiratory depression and with those who are having increased intracranial pressure. The next one is the chain stroke. So here, when breathing occurs, when there are periods of deep breathing alternating with periods of apnea, then it can be termed as the chain stroke respiration. So whenever the client is breathing and if he finds that there are periods whereby he has to take deep breath and will be followed by period of apnea, that is absence of breathing, then we can term that client to be having the chain stroke breathing. And this chain stroke is also seen in patient or in clients with heart failure, drug-induced respiratory depression, uremia, and also brain damage. And the last one is the Bayes breathing. So this is characterized by unpredictable irregularity of the respiration. And this may also be seen in clients with respiratory depression and brain damage at the level of the medulla. So I'll be concluding this topic for today. In today's session, we have discussed about the respiratory assessment. We have discussed about what are the various history we need to collect from the client, as well as what are the various things we need to inspect when we are performing the physical examination. I'll be meeting you guys in my next video where I will be continuing with this same topic, and I'll be teaching you guys about the palpation, percussion, as well as auscultation of the respiratory system. Until then, have a good day. Thank you.